Welcome back to the channel. I'm Dr. Kristina Hammer. We're going to be discussing Eustachian tube dysfunction, a common but often overlooked issue that can affect both children and adults. Stick around to learn about its causes, symptoms, at-home treatments, and when it's time to seek medical care. The Eustachian tubes are tiny passages that connect the middle ear to the back of the throat. Their primary job is to equalize air pressure in the middle ear and drain fluids away. When these tubes don't work properly, it can lead to Eustachian tube dysfunction, or ETD for short. Let's start by discussing some common symptoms and causes of ETD. Some common symptoms that many patients tell me is ear fullness or pressure, muffled hearing, ear pain or discomfort, tinnitus, which is ringing of the ears, balance problems, or popping and crackling sounds when swallowing or yawning. ETD can be caused by various factors, including such things as infections like colds, sinusitis, or allergies that can lead to swelling and blockages of the tubes. Environmental changes, rapid changes in altitude like when flying or diving. Allergies. Allergic reactions can lead to inflammation and congestion affecting the Eustachian tubes. Anatomy. Some people have naturally smaller or less functional Eustachian tubes. Smoking and pollution. Exposure to secondhand smoke and air pollution can increase the risk. You might be wondering why children seem to get Eustachian tube dysfunction more easily than adults. Well, in children, the anatomy is a little bit different. In children, they have shorter and more horizontal Eustachian tubes, making them more susceptible to blockages. Immune system. Immature immune systems make children prone to infections. Adenoids. Enlarged adenoids common in children can obstruct the Eustachian tubes. Now, let's discuss some at-home treatments to alleviate ETD symptoms. Some treatments at home would be swallowing and yawning, encouraging frequent swallowing and yawning to help open up those Eustachian tubes. Chewing gum. Chewing gum can also stimulate swallowing and alleviate pressure. Steam inhalation. Inhaling steam can help reduce the congestion that most people feel. Nasal sprays. Over-the-counter nasal sprays can ease nasal congestion, helping the tubes function better. One thing that I do like to tell patients is by using a nasal device such as the Davage nasal saline device before using a nasal spray does help clear out those mucous membranes so that when we clear the mucus from those membranes, those medications can work more efficaciously as well as effectively. Hydration. Stay well hydrated to maintain the thin mucus required for normal tube function. While many cases of ETD can be managed at home, it's essential to know when to seek medical care. What I like to tell my patients is when they need to seek medical care is when they have severe or prolonged symptoms. If symptoms persist or worsen after several days, it's important to seek medical professional help. Fluid drainage. If fluid drains from the ear, consult a healthcare professional immediately. Hearing loss. Any sudden or significant hearing loss requires immediate attention. Children. If your child has recurring ear infections or persistent ETD, consult a pediatrician or an ENT specialist. Well, that's a wrap on Eustachian tube dysfunction. Remember, ETD is a common issue and you're not alone if you're experiencing it. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more informative content. If you're concerned about Eustachian tube dysfunction, consult ear, nose, and throat specialist, an ENT. Share your experiences in the comments below as your story could help others going through the same challenges. Check the video description for additional resources and information about Eustachian tube dysfunction. Thank you for joining us today, and remember, your health is essential. Take care, and we'll see you in the next video. Bye.